Hello everyone, welcome to this webinar, Nature's Best Kept Secret. And with us tonight are Dr. Eileen Riley and Marie Sanderson. Dr. Eileen is a consultant in obstetrics and gynecology, and she specializes in restorative reproductive medicine. And she focuses on identifying and treating the underlying causes of fertility, working with the body's natural rhythms. And her approach combines medical expertise with a compassionate and holistic view of women's health. And also with us tonight is Marie Sanderson. Marie's a teacher with Fertility Care Scotland for over 25 years, and she's passionate about helping women and couples and health professionals appreciate the beauty and the science of the reproductive system. She's married to William and is a mum of 6 and has been a member of the training team since 2018. So welcome both. And maybe Marie, start with you. Great title. Why is it called Nature's Best Kept Secret?
Thank you, Paul, and thank you for being our host this evening. Secret, I suppose, is probably because it's not as well known as it should be. Relatively few couples are using natural fertility regulation. Apparently about 2 to 4%, depending on whereabouts in the world you are. Natural because it reveals the nature that's created in us by God. All things have a nature, and our bodies have a language, and we can understand this language of fertility. So that's it. The nature's best kept secret is natural fertility regulation and learning more about how your body works.
Fantastic. So going into sort of the basics about it, maybe Eileen, how does a woman know when she's fertile without using an app or a test?
Okay, the woman will notice, she will tune into her body and she will recognize discharges that vary throughout the month. So obviously you've got your days of bleeding, and then usually you have some dry days, and then you go on to your mucus cycle, and then ovulation occurs, and then you go into what you call the luteal phase, when the corpus luteum and the mucus dries up. And she can pinpoint from that roughly when she's fertile from the mucus. It's a bit like she'll feel a discharge down below. She can sometimes notice it when she's wiping herself, and the changes that are happening in her body that she can see reflect what's happening in the pituitary gland, which then reflects what's happening in the ovary, then what reflects what's happening in the endometrium. And we really call ovulation being like the 5th vital sign. Ovulation is a sign of health. And if she isn't seeing these signs, then there could be something wrong. She could have polycystic ovarian syndrome, where women are not ovulating very regularly. Endometriosis can affect the quality of ovulation. Underactive thyroid gland can show itself up because they're not ovulating regularly either. So there's a whole host of abnormalities that can actually show up in the fertility cycle. So it's very empowering for women to understand what's happening in their bodies. Also, if a woman's got abnormal bleeding, that could point to fibroids, it could point to a polyps, it could point to something a little bit more sinister. So if women tune into their bodies, they begin to know what's normal for them, and then they can recognize what's abnormal. And that could then alert them when to seek help, when to go to their doctor. So all this information is really valuable for women, and she can use it as a method to achieve or avoid pregnancy, as well as it being as a monitor of her gynecological health. So it's got lots of different applications for each woman, not just in the fertility awareness aspect of it. So it's really something that can be used really from girls as soon as they start menstruating right through up to the menopause. It's useful at all these different sort of stages in a woman's life. So I always think it's the earlier somebody learns this, the better, really. And it tends to be people try to learn this kind of thing when they're trying to achieve a pregnancy, and it's not really brought in at other times in their lives. There's also PMS symptoms, and you can see if a woman's got a short luteal phase, which often women will get premenstrual symptoms because the corpus luteum isn't working effectively, and just giving them natural progesterone at the appropriate time in the cycle can reverse those changes, make the women feel better. And really, by looking after a woman's gynecological health in the reproductive age group, that will help their health after the menopause as well. So it's a really sort of important window in a woman's life where you can actually, if you intervene, you can make changes, not just for the here and now, but also for the future. So I think it's
Fantastic.
waiting to get out, really. And it's that's really why we're doing this webinar tonight, really to try and share this knowledge and get this secret out there so that people can avail of this. I think it's
Great. And I'm sure this raises lots of questions. So something I forgot to say at the beginning was that if people during the webinar have got any particular questions, down at the bottom of your screen, there's either the chat function or there's the Q&A function, and you can fire in questions that way, and Eileen or Marie will have some time at the end to look at those or possibly pick them up earlier. But the doctor is in, so to speak. So if you have questions. But Marie, the thing they say about natural methods, they go, oh, this is just old-fashioned guesswork, Is there actually any real science behind it? I know there's a story of the Billings. Why is it called the Billings Method, for starters?
Well, that was the World Health Organization that named it Billings. It was the ovulation method, but they did put Dr. Billings, Dr. John Billings's name on it. And yes, there's rock solid science behind it. Obviously, the woman's observations are enough for her to understand and learn the method very simply. So this method can be taught and used by women from all backgrounds, all social economic backgrounds. It's used in many countries where they wouldn't normally have paper and pens for writing, and wonderful ways of charting have been developed. But the science has been done, which backs up what the woman is observing. Firstly, the hormones have been studied in great detail by Professor James Brown. He was actually working here in Edinburgh on an early version of the pill, and he wasn't too impressed with the possible consequences of this. He went out to Melbourne to set up an endocrine clinic, and he was approached by Dr. John Billings. And over the course of his life, he did over 850,000 hormone assays, which have really just backed up what the woman was observing throughout the various phases of a cycle. The other science that was done was by Professor Erik Oderblad from Umeå in Sweden. He was a chemical physicist, and he was studying the properties. The woman's observing how she feels, and she sees the mucus. And we've been able to find out lots more about the mucus, and it's vitally important for conception. No mucus, no baby, in fact. So Professor Erik Oderblad was studying the properties, and he's been able to identify the various roles that they play throughout the woman's reproductive cycle, sometimes ensuring that she is infertile and the fallopian tubes and everything, the reproductive organs are kept, free from infection when the cervix is blocked. And then, of course, during the times of fertility, when the estrogen's rising in the woman's bloodstream, the cervix produces the mucus, which she feels and senses, and this plays a vital role in the sperm transport, nourishment. It eliminates low quality sperm, and obviously helps sperm to travel the epic journey all the way up to the fallopian tubes where fertilization takes place. So yes, there is lots of science. The science has been ongoing. In fact, it's quite exciting, what we're learning in recent years, what's going on behind the scenes.
Fantastic. Yeah, I think as I said to you, I remember learning this in A-level biology or bits of it, and then just talking to you in both as in preparation for this, I've been learning more, and it's all kind of a wow moment. It's nature is fantastic. But maybe Eileen, I mean, people often assume that natural methods don't work. I mean, what's the real success rate in terms of being able to use natural methods to delay or to space pregnancies?
Sure. Well, there's a lot of research been done around it, and the sort of success rate, you can sort of divide it into typical use and perfect use. Yeah.
Right.
So you would say probably overall, there's lots of different forms of natural fertility awareness. So you've got the mucus-based methods, you've got the temperature, you've got a mixture of both. You've got the Marquette method where you use mucus and you also combine that with measuring hormones in the urine. And the Billings ovulation method is obviously a mucus-based method as well. The method that I was taught was the Crichton fertility care, which is similar to Billings as well, but a little bit more of a, I suppose, it was really took the Billings method and they tried to use it to apply it to gynecology really, but it's very similar. And roughly you would say that the success rates are 96% plus if the couple are using it and they're taught it well. And I think that's the real key to it. It's not enough just to pick up an app and say, right, okay, I know what I'm doing here. And I have a little anecdotal sort of stories from patients who say, oh, I'm not using that. That's how I got pregnant. You really need one-to-one tuition with any of these sort of these sort of apps that are out there. And there are hundreds of apps. But the Billings ovulation method, you will get a teacher who will take you through it. And it'll probably take a couple of months for the person to get the hang of it. But I think that's the vital, and that's the bit that's missing. For some to go from a contraceptive method straight on to a natural method, I think they really do need help. And there also is changes when you come off the pill. It takes a wee while for the cycles, for the mucus to start coming back again. So that I would really emphasize that. And I do emphasize that all women that I talk to about natural methods, that you really need some one-to-one teaching. And then you get the hang of it quite quickly. And also, you know, different phases in a woman's life, she would then maybe need a refresher, like when she's maybe had her baby and she starts breastfeeding. That could be another time when the cycles change. Perimenopause can be another time when the cycles change. So sometimes they would get back in touch with their teacher and they would get that one-to-one, just that to really give them a bit of support, really. And also it's good to support the partner, husband, whatever, as well, because often what we used to do, we used to say to the women, you do the observations, but the man does the charting. So then, you know, you've got that communication and he is buying into it as well, because obviously it's a method that takes commitment from both. And you're having to know, are we trying to achieve this month? Are we trying to avoid this month? Or we're not, you know, too bothered one way or the other. So I think the communication between the couples and just that is as vital as anything else. And there are probably about 5 different sort of types of natural family planning, and it really depends on the couple and how seriously they wish to avoid sometimes, and also if they have any underlying medical conditions as well, that you can actually add in cross checks just to, I suppose, increase the accuracy of the using it to avoid. You can measure progesterone in the urine called the PROVE test, where actually you can say you have definitely ovulated and you're definitely in the infertile phase now. If people just want that little bit of extra reassurance that they've got serious reasons to avoid and they just need a little bit more reassurance. So I think there's a method really for any couple out there. And I think I see my job very much as trying to help a couple decide what's the best type of method for them. But I mean, it's the backup they get with the Billings teaching is fantastic. It's free. They can do most of it online. There are some face-to-face clinics available, but most of the teaching now, and Mary will probably tell you better than me, that most of it can be done online, which is really convenient. Can be done in the evenings, you know, so
Fantastic.
I think couple women value that, you know, just that being able to do it online, you know, that's one of the big plus points of COVID.
Yeah, brilliant. And also I was interested to know, and just thank you to Tony on the call for pointing this out, that Billings has a very high success rate for couples who are subfertile or infertile. And I was interested, Marie, just to learn during our discussions about this, that it can be used for that. Also, just thanks to Tony, I think the Q&A button wasn't working, but it is now if anybody wants to fire in any Q&As. But while that's Marie, yeah, usually we talk about it to delay or pregnancy, but you can use it to achieve pregnancy as well.
Yep, certainly. And when the Billings trials have recorded actually a 99% effectiveness rate for avoiding pregnancy, which is very comparable to most modern methods of contraception. But we do have a 78% effectiveness rate for couples. This was a trial that was done in Australia by the Billings for achieving pregnancy, and 65% for those with long-term fertility issues, that is, trying over 12 months. So the rates are very, very good. And we've seen the success in our own clinics. We have probably about 50% or possibly more now, couples trying to achieve pregnancy. And we have, had successes. Last year we had 6 or 7 recorded pregnancies from our teachers. So, we are able to help in these circumstances. We've even had women come to us who've had IVF unsuccessfully, and then they've learnt the Billings ovulation method, and it's happened. There might be a combination of factors involved in there. Maybe they've just relaxed more, but they're, there's working with nature. I actually had a conversation with a woman a few years back now on the bus, for a 5-minute conversation about what she needed to know about her fertility. And then a good few weeks later, she came knocking on my door with a bunch of flowers to say that they conceived. And it was really just that very short conversation was all she needed. They had been trying for, a few years to conceive.
Oh, that's fantastic. Now, I know there's no charge for the services that Fertility Care Scotland provide, but I know, Eileen, you also provide a private infertility service.
Yes, that's right. So any woman that's charting with an actual fertility awareness method, they can avail of, if after a year of trying to conceive, so they do have infertility, I'd be very happy they can be referred on to me, and all I need is at least 2 months of charting, and we ask them to get a series of blood tests done at the beginning of their cycle between day 3 and day 6, and then to get some hormones done 7 days after ovulation as well, estrogen and progesterone. And I just really need 2 months of that to give me, enough information that I can then initiate treatment. So that's something that if you are seeing a teacher, they'll have my contact details. I'm putting my application in for the Nuffield, so I will be able to see people face to face. I do some of this work online, but we'll be able to see patients face to face soon, within the next month or so, I'd imagine. And so patients can get referred directly to the Glasgow Nuffield Hospital to see me if they're interested in a natural approach to help them to conceive. So I don't do IVF, obviously, so it's all, natural fertility awareness, using the information you get from that, doing the hormones at the appropriate time in the cycle. And it's through the charting that you can actually time when to do the estrogen and progesterone level. It should be 7 days after ovulation, which is something that you can determine when you're charting. So I look at the chart, and the chart gives lots of information. So the number of days of mucus they're getting, their hormone levels, if they're getting abnormal bleeding, the length of the cycle, the length of the luteal phase, length of the follicular phase. There's so much information you can get from the chart that can really help me right away almost diagnose what the problem is, which is something that, that in IVF they don't really have. That they ask for day 21 progesterone levels on patients, and as if women are all robots and they're all ovulating in day 14, when, so important to do the estrogen and progesterone levels 7 days after ovulation, which for most women is not day 21. So the charting is really vital. So learning to chart first is the appropriate way then to be referred into myself. And as I say, those in the natural fertility world are aware that they can refer patients on to me.
Great.
Yeah.
So if, aside from your own service, if just, I was wanting to learn more for my family or whatever, where do I start with FCS? And is it difficult to learn? We're talking about, you're saying that, okay, it needs some training, but is it difficult?
Nope, it's not at all. We're teaching a lot of couples now by Zoom, but we do have a couple of clinics in Glasgow area if anyone is wanting to see someone face to face, and we will make arrangements if they would prefer face-to-face teaching. No, it's very simple. Women can become aware of the times of fertility. We're talking about patterns of infertility and patterns of fertility. So it's the observations she made throughout the day as she's walking around, and she fills in a chart every night. Many of us are using the apps now. We have 3 womb approved apps, so that the teacher can look at the woman's charting. So she learns over a period of maybe 2 to 3 months. Obviously, varying in circumstances, this method can be taught to all couples, all women in all circumstances, from menarche to menopause, through all the various, what we call continuum. The woman can be breastfeeding, she can be post-hormonal contraception, she can be perimenopause, and she can be charting on a daily basis. And there are 4 rules to the method, these 4 simple rules that can be applied throughout the woman's reproductive life. So she can make the choices that she needs to make, whether she's avoiding pregnancy or whether they would like to achieve pregnancy and space pregnancy.
Okay. And what would be the 4 rules?
The 4 rules. Well, we have 3 early day rules. They apply to the early part of the cycle prior to ovulation. The first early day rule is to avoid intercourse when the woman is bleeding, heavy bleeding, because she might actually have a short cycle. This may happen out of the blue, even for a woman who has fairly regular cycles. The second early day rule is alternate evenings are available for intercourse when these days have been recognized as infertile. These are through what we call the BIP, the basic infertile pattern. It's the same day after day after day. It's unchanging and obviously related to the low levels of hormones. So alternate evenings are available when she's recognized these. And then the third early day rule is to wait until after the fertile phase, and then she can avoid conception. And the 4th rule is the peak rule. So that's applied when she observes the last slippery wet day of the cycle, and she charts 3 days after that, because ovulation generally takes place on the peak day, or it can take place on day 1, very rarely on day 2, and we allow 24 hours for the life of the egg. So from the end of the 3rd day, from the beginning of the 4th day, she's infertile. So those are the 4 rules that apply throughout the woman's life after she's made her observations.
And I'm actually just a sort of a relevant question from Lisa there. Lisa's just asking, how accurate do you need to be when you're charting?
Well, a woman does quickly learn to make her observations, and she can make accurate observations if she's taught, correctly what she's to be aware of. First of all, it is the sensation, how she feels. And then she has 1 or 2 words maybe to describe anything she just sees leaving her body. There's no need for any internal investigation with this method. And then she records that every day at the end of the day on her chart, and she gets a picture of her patterns of fertility and patterns of infertility. So she can become very quickly able to chart accurately with the guidance of a teacher. She'll be able to understand what's happening.
Okay, great. And Alison is asking, is the Billings method compatible for individuals with hormonal disorders like PCOS or hypothyroidism? Basically what she's saying is individuals with an irregular cycle, and if that's the case, how can you do it with charting?
Yeah. Well, we do have many women who are charting these circumstances nowadays. PCOS is very common.
What is, for people who maybe don't know, PCOS?
Or polycystic ovary syndrome.
Right.
That's something that is very common now with many women for various reasons. Eileen might be able to go into this a little bit more in detail, but we have women with these symptoms. That the cycle does not have to be regular to use this method. That's the beauty of it. It's actually personalized medicine. If you can call it medicine, because it's not really, it's working with nature, what nature's revealing to the woman on a daily basis. She observes these signs, the 5th vital sign, as Eileen called it, and she records it. So it doesn't matter how long or how short these cycles are. She's got a picture of her fertility on a daily basis.
Fantastic. Eileen, is there anything you want to add on that question?
Well, the polycystic ovarian syndrome is probably the most common endocrine disorder in women in the reproductive age group, and it's really it's a problem with the follicle developing, and usually what happens is follicular development is prolonged and delayed, and usually they find they've got long cycles, and you're only really usually women get, only maximum 6 days of fertile mucus, but what happens is the mucus is it's shifted later in the cycle, so they probably have they'll develop maybe a bit, they might get 2 or 3 weeks of mucus, but that mucus there'll be a basic infertile pattern, and then it'll change to ovulation, and she's taught how to notice that change in her mucus, and that then alerts her to the fact that she's coming, ovulation is going to happen. So it's really long cycles, delayed ovulation. They've got to have 2 out of 3 criteria, basically, usually long cycles, signs of what we call hyperandrogenism, which could manifest itself with excess hair or oily skin, acne, and they may or may not have polycystic looking ovaries on scan, which just means that the ovaries are slightly bulky and there's little follicles around the outside. But usually you can tell from the length of their cycles and also their skin, that can be enough just to diagnose it. And it can vary there's a genetic element to it. It's also related to a woman's weight, and sometimes losing weight can reverse it. So yeah,
Okay.
it's
Yeah.
pretty common.
Thank you. And two sort of similar questions from Tony and Elizabeth, both asking about how teachers are trained, and if they wanted to be a teacher, how could they, start learning how to teach it?
Yeah, well, that's wonderful. We'd be really excited if anyone's interested in our teaching. We do recommend the teaching program to women who are using the method, because they are the best teachers generally. But anyone who wants to learn the method and then, consider becoming a teacher, we do have what we call a teacher training correspondence course. So you're able to work through that. Self-motivated with the support of a tutor. So we could have regular online chats to go over the material. So generally that takes about 12 to 15 months, because after all the theory, we have what we call mock case studies, and then a bit of clinical supervision where you're observing the teacher teaching, and then obviously taking over yourself to become a teacher. So that's really exciting to hear that people are interested. We are in dire need of some more teachers. We are quite busy. Many of our teachers who have given years to teaching the method. I could name some of them, but I don't want to embarrass them. They've been involved for many years. They really want to take a little bit of a back seat now, and be involved on the fringes. So, it would be wonderful to have some new fresh blood.
Excellent. And also just a question, Jenny asked a question about, can this improve communications in a relationship?
Oh, absolutely. We see the benefits for couples. It really does foster that communication, mutual agreement in this area. Obviously, the couple have to be motivated, so that opens up these channels of communication. To agree on their goals, whether they are going to achieve pregnancy or avoid pregnancy. And we do find the fruits of that in marriage, and feel that the whole method engenders that desire for a child. So we do generally have large families. It's very, we see the whole meaning of life, procreative and unitive. And that's the beauty of this method, which is promoted by the church, because it's open to natural law. And we're partaking as co-creators in understanding this wonderful gift we've been given. So very much so.
Fantastic. And just another question from Alison. Alison saying, are there contraindications for individuals who are previously on pharmaceutical birth control? So does it affect the applicability if you've been using some artificial method?
We do generally see, a slow return to fertility, a cranking up, we could call it, from obviously having taken pharmaceutical birth control. Various things happen, that affect fertility. That's why a woman takes it, to prevent conception. So the mucus possibly will take a little while to become the kind of type of mucus that's very good for ensuring the sperm survival. Of course, normally the vagina is an acid environment and it needs this mucus for the sperm to survive. So it does take a little bit of time, but I've taught many couples after they've been on contraception. And, it's taken a little while, but they have, generally conceived, within a reasonable amount of time and gone on, quite happily to use the method in the future, fully confident and not having to go back and rely on pharmaceutical methods.
Right, brilliant. Okay, and just conscious of time because we want to finish, on time. But I'll take the last question from Rachel, who just said that she conceived very quickly with her first two children, who are now 5 and 7, and she and her husband loosely followed the Crichton model, but she hasn't managed to conceive since. So the question is, could you explain the 3 days after the peak day where you're at the most fertile? Because Rachel was saying that she used the days that mucus seemed most fertile, but think that we mentioned here it was the days after when it was most effective, if that makes sense. That might be something, Rachel, we can follow up by email, but I don't know, Eileen or Marie, do you want to answer that?
Yes, definitely. The rules of the method, in fact, the peak rule, where we observe that last slippery day of mucus, and we have a change, that is sometimes referred to as the progesterone change. Progesterone being the second ovarian hormone, which acts on what we call the pockets of Shaw and dries up the mucus. So we can see that the last day, the peak day. Now, from all the studies that have been done, ovulation generally happens on the peak day, but it has been noticed to happen on day 1 and very, very rarely on day 2. So these are potentially fertile days. In fact, till the end of the 3rd day, there are channels available for sperm. And if ovulation takes place on one of these days after the peak day, that's when conception has occurred. And we've seen this happen with couples who have maybe broken the rules. They've conceived on day 2. It is a fertile day. So the rules are there for a reason. So that might be something she's found in the past.
Right.
Yeah.
And just, I mean, is there no question you can't answer? I mean, that's good. So yeah, just then to just kind of bring it to a close. And I think we said that after this, Eileen or Marie, you'll follow up with people by email just to give them details of FCS and Eileen, your infertility service.
Yeah.
And then, yeah, nature's best kept secret is out, isn't it?
Yeah. Yeah, we'd appreciate everybody, spreading the word. There is a very reliable, simple method that can be used by any woman. So we'd encourage you to spread the word.
Fantastic. Well, look, thank you both for your expert input tonight. Thank you to everybody who's been part of the call and the questions. And yeah, we'll follow up by email and continue to spread the good news.
Thank you, Paul. Thank you to you and
Thank you very
technical
much.
support.
Yeah.
Thank you.
Bye then. Yes, thank you, Matt.
Good night, everyone.